Or the final speaker in this series is Thea Walker. Thea is an extension specialist in pesticides, I believe, at Colorado State University. And so she's going to talk about some of the work that she's done that's been associated with funding from HICAHS.
Thank you, John. Good morning, everyone. Let's see if you can see that. There we go. So I am Thea Walker with CSU Extension as the pesticide safety educator. You did get that right, John. And I just want to talk about Emerging Issues grant that was funded by HICAHS, entitled Train the Trainer, Building Capacity for Respiratory Protection in Rural Colorado and Utah. See if I can get this to move. Good. Sorry. There we go. So what is the issue? Well, under the 2015 revision of the Federal Worker Protection Standard, certain provisions of the Occupational Safety and Health Administration Respiratory Protection Standard were adopted. Agricultural employers and commercial handling establishments must now provide medical evaluations, fit testing, and training to handlers when using pesticide products that require the use of a respirator. And this includes the particulate filtering face piece respirators, such as the N95s. Many agricultural employers are not aware of where to obtain medical evaluations, how to conduct a fit test, or what type of training must be provided. This is an example of a biological insecticide, Agree-WG, which has Bacillus thuringiensis as the active ingredient. When you examine a label that has the Ag Use Requirement box under Directions for Use section, you must comply with Worker Protection Standard if using the pesticide on farms, in forests, nurseries, and in closed space production facilities when producing a commodity. When reviewing the PPE requirements of the label, it indicates that mixers, loaders, applicators, and other handlers must wear a dust mist filtering respirator, which means that they must comply with the respirator requirements in the 2015 revised rule. This requires a medical evaluation, annual fit testing, and annual training. Most agricultural employers do not have the knowledge or the local resources to comply with this requirement. However, other employers, such as those that provide applications in structural or landscape environments, are also required to comply with the OSHA Respiratory Protection Standard. Many of these entities also lack the knowledge or resources to comply. This Train the Trainer was designed to provide local individuals with the knowledge, skills, and tools necessary to train others in communities on how to comply with the respiratory regulations and how to conduct fit tests. The total amount of funding that was requested under this grant was $20,000. And I just wanted to show you this because it covered travel for 4 trainers and technical materials such as respiratory guides for attendees. However, most of the grant funds were used to develop fit test kits, which would be placed in these communities with one of the trainees so that there's easier access to fit testing. Finally, a small portion was spent on salary because that's required by CSU for all grants, as well as their indirect costs. The workshops were held in 4 locations. We began in eastern Colorado at Fort Morgan, then traveled westward to Grand Junction. Then we went to southwest Utah to St. George, and finally ended up in Kaysville, Utah, in the northern section of the state. The trainers included 2 folks from the North Carolina Agri-Medicine Institute, nurse coordinator Jessica Wilburn and AgriSafe nurse Cynthia Smith. They led the training and were invaluable resources due to the number of fit test workshops they've conducted, because they have the experience to determine how to make adjustments when someone fails the fit test. Myself, representing CSU Extension, and Mike Weirda, representing Utah State University Extension, provided additional support to these facilitators. The training is designed to help participants understand EPA and OSHA medical evaluation and respirator fit tests now required under the new WPS regulations. Participants would also learn how to select respirators and cartridges based on label requirements, and understand how to obtain and document medical clearance. They will learn how to correctly clean and store different types of respirators and how to prepare for pesticide inspections. They'll also deliver and document employee training on respirator use and care. And finally, they're going to learn how to conduct and document qualitative respirator fit tests. This is an example of the materials that were placed in a fit test kit. They were intended to be placed with individuals attending the training who volunteered to provide fit testing within their communities. We didn't put any restrictions on them in Colorado, whether they can charge for that service or must do it for free. In Utah, the fit test kits were placed in Utah State University extension offices for checkout. And I just want to point out a few things, that they actually cost a little bit more than we budgeted. We were able to find them from various sources, so we did do a little comparative shopping. But each kit had half masks with combination organic vapor and P100 filters. We had 2 brands in 3 different sizes, because not one mask fits all. We also had P100 filters with nuisance organic vapor relief. We did have disposable N95 masks with organic vapor relief in 3 sizes, which is very difficult to find now. And then we had respirator wipes, and we stored everything in the plastic storage box. The number of people we trained in Colorado were 10 in Fort Morgan and only 2 people in Grand Junction. Timing was probably a little too late to attract more people, because we conducted this the first week of April, and most people in Colorado are already busy with agricultural activities. In Utah, 26 people were trained in St. George and 30 people were trained in Kaysville. Mike had a great response, and I believe a lot of that can be attributed to the fact that he offered pesticide applicator recertification credits. So these kits are available to borrow at no cost in Colorado and Utah. However, in Colorado, they are placed with either an extension agent or an individual who is willing to do it for their community. In Utah, the Utah State University agents and specialists do manage the kits. They check them in and out. And then the pesticide safety education program at Utah State will provide replacement supplies. We did evaluate the workshops, and I'm just going to show you a few of the questions. We did a before and after knowledge check. So the first question was related to OSHA and WPS regulations related to respiratory protection. And you can see that most people had a very low level of knowledge, and we saw a great improvement after the workshop. So more people are confident that they understand these regulations. The second question was their knowledge about how to determine what personal protective equipment they would need for different chemicals. And again, you can see that most people felt relatively comfortable with their knowledge. We had a few people that were in that very low category, but you can see that we had a great shift in our knowledge base, where more people are comfortable with how to determine PPE. The third question we asked was their knowledge about different types of respirators and cartridges and what they protect from. You can see, again, we had a great increase in their knowledge level, with more people feeling more comfortable about how to select what respirator they need and understand what cartridge they must also have. The next question involved cleaning and storing respirators. You can see before the workshop, not a lot of people were very comfortable in their knowledge on how to do this. And so we saw a great increase in their knowledge about how to take care of them. And it was interactive, hands-on activity on how to break down your respirators, clean them up, and reassemble them, and how to store them. Another question we asked was how to obtain medical clearance for wearing respirators. Very few people knew how to do that. And after the workshop, many more people felt comfortable that they could find that service. And finally, the most important part was how to conduct a respirator fit test. And you can see very, very few people were comfortable in their knowledge on how to do so by simply doing the hands-on, walking them through that process. You can see that we had a huge shift in people's confidence level on how to conduct a respirator fit test, a qualitative one. So what were some of the lessons we learned? Well, we need to pick a better time of year so we can get more people there. We should advertise more, maybe connect with recertification workshops and offer those credits. We can look for unusual targets, including search and rescue people, as well as volunteer fire department folks. We do have to address liability concerns for workshop trainers and fit testers. And we do need to recognize that not just people involved in agriculture need this, but also people involved in other types of pesticide applications. So what are our next moves? Well, in Colorado, I still have 6 kits to distribute, and I plan to work with nurses from National Jewish. However, you know what happened. In Utah, Mike collected all his kits back in March because he wanted to do another round of training, and then COVID happened. And now you know that we are all kind of handcuffed. One of the biggest challenges we have is how do we disinfect these hoods that we use for fit testing between people. Some unexpected outcomes we had is that we were able to work together with others to develop a respiratory collaboration group that has people from pesticide safety education programs, industry, state lead agencies, NIOSH, lots of people. Whitney Pennington is actually a very valuable member of that group, so I'm excited about that. This group is designed to develop and share resources, and one of the resources that we did develop was this respirator decision tree on whether people are keeping themselves safe and meeting legal requirements. And this was a result of COVID. What do you do if you cannot get your particular respirator? This collaboration group has a lot of their materials posted at the National Pesticide Safety Education Center. You can see the URL there, and I'll repeat that in the chat box. This is the backside of that particular document, telling people if you cannot find an N95, here are some other possible options. And with that, I'll conclude and turn it back over to you, John. Thank you.
Thanks, Thea. That's great.